Good morning, everyone. I am Dr. Archita Agarwal from Department of Public Health Dentistry, and today the topic of the presentation is MID, that is Minimal Invasive Dentistry. The contents are introduction, definition, principles, the minimal intervention approach, cavity designs for minimal intervention, dental public health significance of MID, conclusion, and references. Introduction. The goal of minimally invasive dentistry or microdentistry is to conserve healthy tooth structure. It focuses on prevention, remineralization, and minimal dentist intervention. Using scientific advances, minimally invasive dentistry allows dentists to perform the least amount of dentistry needed while never removing more of the tooth structure than is required to restore teeth to the normal condition. In addition, in minimally invasive dentistry, dentists use long-lasting dental materials that conserve the maximum tooth structure, so the need for future repair is reduced. So this is the GB Black classification of the dental caries. It has a surgical approach which includes the removal of the diseased tooth portion. He classified caries into 6 classes: class 1, 2, 3, 4, 5, and 6. And then there is an approach of extension for prevention, which shows that we have to extend to the areas presumed to be caries resistance. As we all can see in this photograph, that there is extension of the cavities for the restoration. So the traditional preparations, it incorporates the removal of the smaller amounts of caries as compared to healthy dentine. So as we can see in this picture, this is the normal tooth structure which has been lost from the tooth, and the black portion, that is the decayed part or the caries. So for the traditional preparation, we'll remove only the areas that is your infected dentine, and we do the preservation of the affected dentine. So since the development of ultra-high-speed rotary cutting instruments in the 1950s, there has been a tendency to extend a cavity even further, and the resultant weakening of the tooth crown has led to a marked increase in replacement dentistry, wherein there is a further loss of tooth structure upon each replacement of a restoration. Restorative and endodontic treatment do not in themselves solve the problem of oral health. So coming to the definition of MID, minimum intervention dentistry is defined as a philosophy of professional care concerned with the occurrence, early detection, and earliest possible cure of a disease on a micro level, followed by minimally invasive treatment in order to repair irreversible damages caused by such disease. The difference between intervention and invasion is that minimal intervention dentistry deals with the detection of disease, identification of risk factors, and specific protection to prevent disease. Minimal invasive dentistry or ultra conservative or microdentistry includes all the operative procedures to ensure preservation of healthy tooth structure and minimize the tissue loss. The minimal invasive dentistry is a subset of minimal intervention dentistry. Coming to the principles of MID, it includes disease control by reduction in cariogenic bacteria, remineralization of early lesions, avoid removal of any more tooth structure than is absolutely required to restore teeth to their normal conditions, use of dental materials that conserve the maximum of tooth structure, use of only the strongest and longest lasting dental materials to reduce the need for future repairs and replacement. Next is repair rather than replacing defective restorations. Use of dental procedures that keep the number of necessary appointments to the minimum. So these are the principles of MID. Next is the golden triangle of MID. It includes 3 main components, that is histology of the dental substrate that is being treated. Adhesive material should be used for restoration. And main is the consideration of technique that excavates the caries minimally. So, a thorough understanding and appreciation of the interplay between three critical factors is required to achieve success clinically when using a minimally invasive operative caries management strategies. So, these are the three components of the golden triangle of MID. Next is the minimal intervention approach. Cariology has advanced over the past 30 years with scientific advances in the knowledge of caries process in terms of its pathogenesis, its transmission, the demineralization and remineralization continue, the mode of onset of fluoride, but also with respect to the great technological developments in biomaterials, equipments for the detection of caries, lesions, and methods of cavity preparations. These include early detection of caries, and second is the caries removal and restorations. Early detection of caries, it includes visual and tactile examination and dental radiographs, which are commonly used for caries detection. In the recent years, newer caries detection methods and devices have been developed as traditional caries detection procedures do not detect caries until they have progressed through at least the thickness of the enamel. So this is the first step, that we have to do the early detection of the caries, and various methods are available for it. So various visual and tactile methods are there, and other methods for the detection includes laser fluorescence, fiber optic transillumination, digital imaging, fiber optic transillumination, ultraviolet illumination, electronic caries detector, dye penetration method, quantitative light-induced fluorescence, ultrasound imaging, endoscope, videoscopy. So now coming to the next part, that is the caries removal and restoration. So rotary instruments used for the treatment of carious lesions have often resulted in a considerable removal of the tooth structure. So newer techniques for the removal of the carious dentine have been developed to minimize this excessive tissue loss. So among the various approaches, we'll discuss about the various approaches that has been used for the caries removal and restoration and for the prevention of the caries. Among this, the first is Pitt and Fisher sealant. So the development of sealant has progressed from the first generation of sealants, which were activated with ultraviolet light, through the second and third generations of autopolymerized and visibly light activated sealants, to the fourth generation containing fluorides. So this is the photograph which you can see how the dental sealants are applied. So before, we can see the deep unprotected grooves are seen on a molar teeth, and after the application of the sealant, these grooves have been covered. So they become caries resistant and they are less prone to caries. Coming to the indication of Pitt and Fisher sealants, it includes the deep, narrow pits and fissures where there can be food accumulation, recently erupted teeth, where there are no caries in the proximal surfaces, and patient with high caries risk, though this increases the tendency and need for reapplication. Contraindications for the Pitt and Fisher sealant, it includes teeth with occlusoproximal lesions, teeth with proximal lesions, teeth that have been caries free for 4 years or more, and teeth with based collapsed pits and fissures. So these are the contraindications for the Pitt and Fisher sealant. Next is the preventive resin restoration. This we'll start in the next class. Thank you.